Cleft Clinic meets every second and fourth Wednesday over at the POC at the hospital. We have 2 waves of patients, I guess I can call it that, doing these kids. And basically it's an opportunity to keep up with their care in terms of speech, social work, psychology, language development, and things like that. The opportunity overall is really rewarding to be able to work right elbow to elbow with some of the best in the state that do this. It's rewarding to be able to work with families as a whole and be able to make a difference in a child's communication. Communication has a lot to do with a kiddo's identity, how well they're going to do academically. And so what I personally find rewarding is that I have the knowledge to be able to help those kinds of folks do better. I've learned that every patient is different. Every patient is very much worthy of all the knowledge and the best resources that we can pull together. I've learned a tremendous amount about the value of interdisciplinary work. I'm no good as a speech language pathologist for a patient with a cleft without the social worker, without the nurses, without the doctors that also have experience in the area. So a lot about collaboration, a lot about working together, and a lot about really problem solving to help these patients the best we can.